Hi, my name is Dr. Rich Hilsden, and you're watching my channel, Knife Skills. Today I want to talk about pre-rounding. What is it and why do we even do it? There's been a few videos on YouTube lately, some medical student videos, but most recently, Dr. Glaucomflecken, obviously one of my favorite YouTuber, TikTokers, comedian really, talked about pre-rounding in one of his most recent videos.
Why do you have to go into work so early?
I have to pre-round on all my patients.
What does that mean?
Well, we have rounds, which is when the team gets together and we go see patients.
Yeah, okay, that makes sense.
So pre-rounds is when the med student goes to see the patients before rounds.
Oh, like the day before?
No, like an hour before.
Well, why don't you just wait and have everyone see the patient during rounds?
Well, the med student collects all the data during pre-rounds and then presents it to the team during rounds.
Oh, so it makes rounds more efficient by having all the data beforehand.
Really sort of lightly saying, why should we be even doing it? But I will be here to say that there actually is a role for pre-rounding, and there may be a reason why you as a medical student could be expected to do that. Now, as I say that, I want to put one big caveat here. Many medical students who work at my hospital and work with me watch these videos. And I want to be absolutely clear. In general surgery at our hospital, we do not expect medical students to pre-round. That is not expectation, and we don't want you to do it. But it is important to understand what pre-rounding is, what it's for, so that you can fill the gap that's left behind if you choose not to pre-round or your hospital doesn't have pre-rounding or there's a policy against pre-rounding for medical students. So let's get into it. What exactly is pre-rounding? Well, pre-rounding occurs when a medical student or resident comes into the hospital ahead of time before the rest of the team and prepares information that they can provide as a resource to the rest of the team during regular rounds. So what that typically involves is printing off a list of the patients maybe and writing down blood work results, the results of any imaging tests that might have been performed, any nursing concerns overnight, inputs, outputs, physical exam findings, whatever information you can get, it would be placed on that sheet so that you can communicate with the residents or the rest of the team when the rest of the round is happening, and then you can be a resource. One way to think about that role is to use the RIME framework that oftentimes characterizes the development of a medical learner throughout their training. And that RIME framework starts with reporter, interpreter, manager, and educator. Typically, medical students will be working within that reporter and interpreter framework. It's only when you become a resident, really, that you start to move much closer to the manager phase, and really not until the end of your training, the end of your residency, later on when you graduate, that's when you truly become an educator, where as much of your time is being spent managing as it is training and teaching and passing on information to other learners. So for a medical student, it's really important that you're working well and being efficient in the area that you're expected to be. And that's that reporter and less so, but still there, interpreter framework. And so what pre-rounding does, it allows you to get to know your patients, understand the blood work, understand the issues, so that during rounds, you can have that information available for the rest of the team. You can play that role of reporter, allowing residents at higher levels with more experience to play that role of interpreter manager. Now, again, coming in early to pre-round may or may not be possible, may or may not even be part of the policies at your hospital. And absolutely, if that's the case, don't do something you're not expected to do in that case. But I will say you do need to replace the essence of what pre-rounding provided with something else. So one strategy that I would have in mind would be get to know a small number of patients on your team very well. You may not be able to know all 10 or 15 or however large your rotation might be. Maybe learn 2 patients extremely well, know their blood work extremely well, know their social situation, know their names of the family members that are key decision makers, know if any tests are coming up, read the report before any other resident has read it. So you have that information first. If you're not scrubbed in a case and you're observing maybe, and you have a little break or lull, or you can't see something, you might take that time to read the chart if there's a break or some downtime so that you're really well prepared. You want to still feel that role of reporter. You want to still embody that as best as you can. So that's one strategy. You may be able to read charts at the end of the day in preparation for the next day, so you're well ready, or you know what blood work or stuff that will be ready by the next morning. That's another way to do it, so you can stay later rather than coming early. Or you may have access to the chart in some other ways. Certainly in my institution, medical students typically don't have the access to electronic medical record at home, but that may be different at different institutions. So you can prepare yourself in multiple ways. The other thing that you can do to help be a reliable reporter is oftentimes to read ahead on cases. If you know what surgeries are coming up, then you'll know what issues are important, and that'll help you draw out information when you round on the patients with the rest of the team in the morning. So those are some strategies for you to use if you're not pre-rounding. So what I would say is pre-rounding is really rotation, hospital, school, and student dependent. I don't think everyone should pre-round, but if you don't pre-round, be ready, be prepared, play that role of reporter. My name is Dr. Richard Hills, and thank you for watching. If you have any tips as a medical student on how to be ready for rotations, how to be ready to round, I'd love to see those comments below. I'd love to see a like and subscribe. I appreciate all of those comments and all of those engagements. It keeps me going and motivated to create content. Thanks for watching.